So yeah, the types of surgery I focus on breast and body, and specifically, I do a type of procedure. I either remove breast implants from women who are having trouble or no longer want their implants, and the other surgery I do is I replace it with fat. So implants out, fat in is the most easy way to describe it. But in I'll kind of break it down each. So the breast explant surgery is in service of a patient population who have either just don't want their implants anymore or are having health or illness related to their implants because implants themselves can cause a strong inflammatory reaction. So I remove the implants. Once the implant is removed, often a surgery needs to be done. It's called a breast lift. So it's basically reconstructing the breast to regain the shape and form. So it's aesthetic and also functional. So it's comfortable to be in your own skin. After the breast implant is removed and the skin is reshaped, I also do a fat transfer procedure. So I do not use implants. I've stopped using implants for over a decade because I don't think they're safe. And it was a stand for basically for women's health, but also to focus on a safer natural alternative, which is fat grafting. Fat grafting is the second big category of surgery that I do. And with fat grafting, it's kind of like a two for one procedure because I have to get the fat from somewhere. So that involves high definition liposculpting. So I'm able to shape and move fat from one part of the body to somewhere else. And I do that with liposuction. So it's literally sculpting the body. I do it mostly awake. And for patients, the reason I do that is threefold. One, it's safer than undergoing general anesthesia. Two, the patients have an easier and faster recovery afterwards because they're not recovering from medication from general anesthesia. And three, I find I can get better results because I'm able to sculpt to the natural muscle anatomy as opposed to when you're fully asleep, the muscle tone goes away. So fat grafting involves essentially two parts. It's sculpting the body and removing the fat from one part, and then once that fat is collected and harvested, I can then use it as a sculpting medium, literally like a tool that I can sculpt with, and I can put fat just about anywhere. The most common place I put it is the breast as an alternative for implants, but I also use it instead of implants for patients who want to avoid implants or after breast cancer for women who've had breast cancer to reconstruct the breast. Fat can also go in the hands, it can also go in the face, and it can also, a common area also is the buttock.
Wow, that's very interesting. Liposuction in particular, you hear horror stories about it. What are some of the side effects? You're describing a different method than anything I've ever heard. I'm certainly not an expert, but like, what are some of the horror stories you hear, and maybe where do you separate like the myths versus the facts about liposuction?
Great question. Yeah. And, liposuction is actually, I would say, one of the more dangerous plastic surgery procedures out there. The reason is because it's often not, many times the people performing liposuction are not board certified plastic surgeons. And which is it's a whole nother side conversation, but I'll just say this briefly. There's very few medical specialties where you could not be board certified and still perform it. For example, I can't just randomly go do heart surgery on a Tuesday, but a dermatologist or a pediatrician or gynecologist could actually get privileged to do liposuction in the hospital,
Wow.
which is unusual, but it's just the way the aesthetic cosmetic surgery world has evolved. So the reason liposuction is more dangerous because first of all, there's a lot of people who aren't trained properly in doing it. But even among the people that are trained and board certified in it, it's not what they do all day, every day. And like any skill, if it's not your core competency, it's likely that you may not be as proficient in it, and you may encounter complications more often. And those complications can be um, life-threatening, or they can be less life-threatening, but still really unfortunate for the patient. Like you can get sort of bad-looking results and things like that. So liposuction is essentially using a mechanical device with suction, literally suction to the wall. It's a negative pressure, and there's a number of different ways that it's done, but it will, with a vibration suction, remove little bits of fat over a large area. There's many different kinds of tools out there that do it, and there's many different ways to do it. Personally, the way I do it is it's awake liposuction with tumescent anesthesia. What that means is that patients are awake, they're medicated, so they're comfortable, and it's probably closer to something like going to having a major dental procedure than like full on like in major invasive abdominal surgery. And tumescent means that I numb the skin and all the layer of fat between the skin and the muscle. And once that area is numbed, it's very easy to work in that plane and remove fat and tissue from there. And the tools that I use they're literally like these little sculpting tools. Like they take out little tiny bits of fat over a large area. And with the combination of vision, so where I'm looking, the feel of my hand, also knowing the anatomy, I'm able to sculpt and create a shape in the body.
Wow, that's fascinating. I've also heard, again, horror story with liposuction, wherever you remove the fat will kind of gather around the area a little bit differently when you regain fat? That's a whole nother thing
Yeah,
that we're talking about.
that's a valid myth. And I say with all of these myths, there's some kernels of truth, but then the reality is it's in the details. So there's some truth to that, but not really. And I don't see that in my practice, and I'll explain why. So anywhere I remove fat from, that fat is gone forever. But fat cells have an almost infinite capacity to grow and expand. So whatever fat cells remain can still grow. What you're describing is between an area that's treated and not treated, if the fat gets removed from one area and not from this other area, there's going to be like a disparity. There's going to be a difference in size. And if that area is not blended, there can be a shelf. And so when fat grows and changes afterwards, it can appear that there's like a bump. The technical thing that I do is it's called blending. So once you've finished treating a certain area, you blend into the area that hasn't been treated before and to create more curve and continuity. So it's not like a step off, it's not like a step, it's more like a continuous regular plane. But fat's not that smart. Fat doesn't selectively go to one part of the body after it's been treated. It still just goes everywhere. So that's the and that's the myth busted.
Yeah, no, I really appreciate that. My wife had the opportunity to do two separate cadaver classes where they were given bodies, frozen bodies, and cadaver tools with Tom Myers, who wrote Anatomy Trains, to be able to dissect
Cool.
bodies and like really get into the body. And she said one of the things that surprised her the most is how little muscle tissue you actually have and how much fat tissue you have. Like
Yeah.
even with this cachexic woman who had passed away from cancer in her 70s, she said she could not believe how much lipid was on a body.
Yeah, it covers every square inch of your body from your head to toe under your skin. There's fat. There's a fat layer just about everywhere, even
Wow.
under the scalp before you hit your
Wow.
skull. There's still a thin layer of fat.